Okay, so first thing we're talking about is connecting to the ground. We're going to think about our foot and our arch. We're going to think about like a tripod. So the center of the heel, big, pinky toe knuckle, and the big toe knuckle. Okay, the toes themselves, all they need to do is just keep neutral and just spread out to widen the base of support. So for practice, I'm going to place one foot up on a second step here, so I have a good bend in the knee. It's going to offload that front leg pretty good, so I can just feel things out and not have to worry about balancing or loading too much, especially if it's a painful side. So I'm going to ground through my heel, and then for that, I'm going to connect through my glute max, my butt. I'm going to try to clench that muscle a bit and try to feel the pressure down through the heel, like I can connect those two pieces. I'm going to try to get my knee to come out by, once I'm grounded through the heel, to leverage my knee out like a clamshell. So I call it kind of like a functional clamshell. And then you're going to get your knee, as it's bending and coming out, towards your pinky toe knuckle, your chest, and say your belt buckle area. And we're going to turn that pelvis just slightly in that direction. So everything here is kind of guiding towards that big toe knuckle. If we're on level ground, or if I'm actually going to step up, ideally I want to get my chest, my center of mass there behind the sternum, dead center in my chest cavity, over the arch of my foot, the inside here between those 3 points. But I'm going to practice shifting in that direction. As for my back foot, I'm going to try to get my big toe at least neutral and forward, maybe slightly in, so I can, that's kind of like the rudder. I want to steer the ship towards my weight, towards the center here. So everything is guiding me in that direction to get over top of that arch. So I'm just going to practice just like a lunge here, just kind of gliding, grounding through my butt and my heel, knee towards pinky, chest and belt buckle towards that big toe knuckle, and that big toe in the back as I lift my heel up, preferably, to get everything kind of going through that rudder and steering everything smoothly and cleanly. I'm going to compare to the other side and make sure that both feel equally controlled and balanced. And oftentimes what will happen is a patient they may not be able to pinpoint it, but they'll recognize that one side is smoother and easier than the other. And those are things you want them to pick up on in practice. Okay.